Alright team, listen up. The patient presents with P-xanthine bursitis, myopercarditis, and 12-hydroxyicosapentaenoic acid.
What do we think we're dealing with here?
Those symptoms could point to a variety of conditions. It might be an autoimmune disorder or even a rare genetic mutation.
I'm leaning towards a cardiac condition, considering the myopericarditis. We should run some more tests to confirm.
I disagree. I think it's more of a joint issue given the P-xanthine bursitis. Maybe something related to inflammation or arthritis.
What about the 12-hydroxyicosapentaenoic acid? That's more indicative of a metabolic disorder, isn't it?
Enough. You're all wrong. It's iridogonadysgenesis, dominant type.
And we're going to perform a prostatectomy?
Wait, prostatectomy. That's a risky procedure, especially for a patient with these symptoms.
I don't care. It's the only way to save the patient. We're doing it.
Hawks, this disease is regarding the eye. Why would removing the prostate help the patient?
This sounds like a really bad gamble. I'm on the edge of being on the fence about this.
It's not a gamble. It's the best way I know in how to save this patient. Now quit edging and remove that prostate. You wanted to see me, Tracy?
Hawks, what is this? I hear about you wanting to perform prostatectomy on a patient with iridogonadysgenesis, dominant type.
I believe it's the right course of action for this patient.
And where did you get such a ridiculous idea?
Just a friendly bet I made with Dr. Johnson for $1 on whether the patient survives.
You bet $1 on your patient's life. How the hell is that remotely ethical?
It's an incentive. You've been blaming me for messing up cases recently, so I decided if I really want to earn my keep, I'd be willing to gamble it with Dr. Johnson, whose patients have worse odds than I do in this case.
That is the lowest of excuses I've ever heard you tell. I thought I had heard them all, but this is easily your worst.
I know. That dollar means a lot to me, but if this goes wrong, it's a sacrifice I'm willing to make.
Gary, we need to act fast. The patient is in critical condition after the prostatectomy.
What the hell happened? It seems like the prostatectomy was not the correct treatment for iridogonadysgenesis, dominant type, despite Dr. Hawk's insistence.
What do you suggest we do now? We need to figure out the right treatment for this patient before it's too late.
I think we should consider a different approach, maybe a combination of medications and surgeries. We can't lose hope just yet.
You may be right, Gary. Let's review the patient's history and see if we can come up with a better treatment plan. We can't afford to make any more mistakes.
What the hell were you thinking?
Misdiagnosing iridogonadysgenesis as the dominant type and performing a prostatectomy. You nearly killed the patient.
I'm sorry, Dr. Hawks. We thought we had the right diagnosis.
We were following the symptoms presented to us. It seemed like the logical course of action at the time.
It was an honest mistake. We didn't mean to cause harm.
We should have double-checked before proceeding with the surgery.
You should have double-checked. You all should have triple-checked. You're all a bunch of incompetent fools.
No, you're right. When we double-checked, we should have skipped right to triple dog checking.
Yeah, please tell us what we missed so we can learn from this mistake.
We want to make sure we don't make the same error in the future.
Please enlighten us so we can improve.
I don't have time to babysit a bunch of morons like you. It's like you're trying to ruin me through sabotage.
Sabotage? Oh, is this related to that stupid bet you made with Dr. Johnson?
What the hell is wrong with you? First you bet on a patient's life, then accused us of harming the patient so you lose it. All over $1 goddamn.
A man's gotta eat, Leslie. You can't even buy anything on the value anymore with just $1. Hawks is making a real sacrifice here.
Speaking of which, I have lunch.
Possibly my last one thanks to you idiots.
So, Johnson, how are things going with your patients in oncology?
Pretty good, actually. We've had some promising results with the new treatment protocols.
That's great to hear. I've been so caught up with this one case lately, though. It's been driving me crazy.
Oh, what's going on with your patient?
Well, they were somewhat fine when they came in this morning. Then somehow someone blabbed about our $1 bet if my patient survives the prostatectomy. My doctors caught wind of it, then sabotaged the patient's health so I'd lose.
Wait, you took that $1 bet serious? I was joking.
There are no jokes in bets, Johnson.
Especially when it revolves around a patient's survival.
Your patients gamble a lot with their health. I can't believe you are backing out of this bet now. Just for that, I will find out what is wrong with the patient. Now, excuse me, Johnson, I have $1 to save.
Why do I even joke with this asshole?
I have solved it. It's Schindler disease, not iridogonadisgenesis.
Hawks, you can't just barge in here without proper gear.
This is a sterile environment, Hawks. Have some respect.
What makes you so sure about the new diagnosis?
Dr. Johnson had lunch with me. We discussed the symptoms. It all adds up.
Do you think it's possible Johnson gave you the wrong diagnosis so he could win that $1?
That's unethical. How dare you slander the head of oncology?
So, what's the prognosis for Schindler disease then?
The prognosis is poor. There's no cure, only management of symptoms.
We need to inform the patient's family right away.
Hawks, next time please follow protocol. The scrubs are free in this hospital. Anyway, you get your $1 back. Happy?
I can't believe I got it wrong, Tracy. It was Schindler disease, not iridogonadisgenesis, dominant type.
Well, it happens, Hawks. The important thing is you found the right diagnosis in the end.
Yeah, but this wouldn't have happened if I didn't have such evil doctors on my team.
Wait a minute, Hawks. Evil?
They purposely put the patient in critical condition to try killing them so I'd lose my $1 against Dr. Johnson.
That's outlandish. Don't you ever put a patient's life in such a stupid bet, especially one that cheap.
It was Johnson's idea.
He was joking. I cannot believe you took the idea seriously, especially when you would severely punish your own team for making bad judgment calls.
Whatever. I'm taking my winning $1 and I'm going to get a junior cheeseburger. Good night.